A surgeon does a lot of planning and strategizing before a patient goes under the knife. But oftentimes the full picture of that surgery doesn't become clear until well after that first cut is made. But things are about to change. Now you can join your surgeon on a 360-degree journey and explore your own surgical procedure. We're talking about virtual reality, VR for the OR. Joining us now to show how this works is neurosurgeon Dr. Kurtis Auguste. Doc, this is pretty cool.
You know, it's funny. This is sweet validation for all those hours spent in the video game world that I did. My mom yelled at me all those nights, and it paid off.
Yes.
Well, you came into medicine at the perfect time, and before we get into how this actually works, because virtual reality is something that is happening, Dr. Auguste is using this. We actually have one of his patients in the audience, 15-year-old Mathias with his mother, Lindsay. Welcome. So good to have both of you. So, Mathias, I wanted to talk to you first because you actually use this virtual reality for your own brain surgery.
Yeah, it was so surreal. I mean, I had never done anything like that before, and let alone for something that I would be a part of. This past few months has been hard for me. I've been paralyzed. I lost my ability to speech, and I gained all that back, and it was all thanks to Dr. Auguste and the research that he's done and his team, and especially with this VR. I mean, it's amazing what it can do, and the possibilities that we have with it. It's just incredible.
I think it's remarkable because there are two huge benefits as I see it. One is being able to relate to your patient. And Lindsay, as a mom, I know it's so anxiety-provoking. Anybody going into your own child's brain and having this issue, being able to plan that in advance, visualize what's going to happen. So I think there's that one huge benefit. And then the second is for the surgeon, him or herself, to be able to go in and simulate what's going to happen without the repercussions, the ramifications of a real surgery, to do a test drive.
The beauty of this system is that it's immersive. It's 360 degrees. It actually shows you what you're going to see at the time of surgery, and with no harm to the patient.
And we're about to delve in and show everyone how it works, but first things first, Lindsay, I want to ask you as a mom, was this reassuring for you to be able to virtually see the surgery and what was going to take place?
Yeah, completely. I feel like we encountered a tremendous amount of suddenness and surprise with Mathias' diagnosis, and this technology was able to kind of counterbalance that just crazy amount of scariness. And Dr. Auguste was able to utilize it to elucidate his plan, and moving forward with that clarity, we were able to feel a lot more hopeful and confident about the procedure. As scary as it still was, it was really, really comforting to be able to have that knowledge at your fingertips and to feel like you could literally put your hands on what was going on in his head. And I think our whole family felt really empowered and hopeful after experiencing it.
That's great.
Now, Mathias, I want to ask you, is it okay, because we have the virtual reality model of your brain that was used to emulate your surgery. Is it okay if we take a look?
Please, I insist.
Take a walk through your brain. All right.
So show us how this works, and in so doing, you can also talk a little bit more about what you were doing in Mathias' particular case.
I recommend putting the goggle part on your face first and then sliding that strap on the back of your head. So just look straight ahead, act natural. Okay, you're going to see what I see. And so here, hopefully you recognize this good-looking guy. This is Mathias. This is actually his face reconstructed in 3 dimensions. So this is the first view I want to show you, just to orient you. The next view I want to show you is the surgeon's view. So what do I see when I position the patient on the operating table? What kind of vantage point do I see? What's this one? I'm standing at the head of the operating table. I'm going to point out for you, this is his ear. His left ear. This is his incision wrapping around here, okay? And then the first part of the surgery for him, he came to me with a bleed. And as he mentioned, it paralyzed him and it robbed him of his speaking ability. So his brain was under pressure.